Hey everyone, and welcome to today's Explainer. Today, we're going to completely rethink how we approach a super common, yet honestly incredibly complex topic, and that's diabetes management. For a lot of folks, living with diabetes just feels like this frustrating, endless chore, right? You're constantly checking your numbers, you're worrying about every single thing you eat, you drag yourself to the clinic, and, well, sometimes it feels like you're just sitting there waiting for a lecture. But what if we could completely flip that dynamic? What if we could take that frustrating chore and turn it into a genuinely powerful collaborative partnership? Well, that is exactly what we're going to do today by taking a really close look at the clinical relationship from both sides of the stethoscope. Okay, let's take a really quick look at our roadmap for today. First, we'll cover the diabetes disconnect. Then, secrets from your doctor. Third is the BPS assessment model. Number 4, the OARS communication framework. And finally, number 5, a lifelong partnership. Let's just dive right in. Section 1, the diabetes disconnect, bridging the gap. So before we even think about building a better partnership with our healthcare providers, we really have to acknowledge the elephant in the room. There is a massive gap between the daily, real-world struggle of living with diabetes and the sterile, clinical advice you get in a doctor's office. Take this quote from endocrinologist Dr. Richard Shoebridge. It highlights a very, very real human behavior. I mean, have you ever kind of sugar-coated your numbers? Honestly, Dr. Shoebridge notes that the sheer fear of upsetting the doctor or, fear of being scolded like a kid actually causes patients to hide their true glucose readings. And this fear, it literally creates a wall. When doctors are only seeing your good numbers, they absolutely cannot accurately assess your health, and they definitely can't help you navigate those dangerous spikes or drops. Moving right along to Section 2, Secrets from Your Doctor. The 12 tips. Okay, so if fear is the thing blocking our progress, how do we break that wall down? Well, let's uncover the first half of our two-way street. These are the things diabetes specialists, endocrinologists desperately want you to know so your visits actually do something. And the core message here really boils down to one thing: radical honesty. You should fully expect your doctor to be nosy. Seriously. Diabetes affects your entire life, your mood, your skin, your sleep, the whole shebang. So you have to tell the absolute truth about your diet and your exercise habits, and for sure, stop hiding those bad glucose readings. Why? Because, as Dr. Shoebridge points out, your doctor is not there to lecture you. They are there to problem solve with you. Oh, and one more thing, even if you feel completely fine, high blood sugar does silent damage. You've got to keep watching those numbers. What's really cool about this whole approach is how it completely reframes the modern doctor. We've got to stop seeing them as just medicine dispensers or strict teachers with a red pen. When you bring radical honesty to the table, your doctor actually becomes your partner. They can only help you make smarter, tailored choices if they know exactly what your day-to-day reality actually looks like. Now, here's another massive misconception doctors really want to clear up. It's the insulin reality check. There is this terrible, unfair stigma out there that needing insulin means you're somehow a bad diabetic and you've failed. But endocrinologist Dr. Irene O'Shaughnessy stresses the actual clinical reality here. Type 2 diabetes is just a naturally progressive disease. That's what it does. Needing insulin does not mean you did something wrong. It's simply a highly effective tool to keep you healthy. Releasing that guilt is just a huge, game-changing step in taking back control. So to round out the doctor's perspective, I want to share a really crucial number with you from Dr. Osama Hamdi: 7%. If you have type 2 diabetes, losing just 7% of your body weight can dramatically improve your health. To put that into perspective, that's only about 12 to 13 pounds for someone who weighs 180 pounds. The message here is incredibly hopeful, right? It is literally never, ever too late to make lifestyle changes and start seeing real, measurable clinical benefits. All right, Section 3, the BPS assessment model. Pulling back the curtain. So, we've talked about what doctors need from you, but how are they actually trained to interact with you? We're going to pull back the curtain on the official playbook from the Ministry of Health that's used to train care teams. Now, before we look at the specific tools, think about this incredible admission from Professor Tai-Yi Xiong, a senior consultant. He explicitly states that when patients don't follow medical advice, it's not the patient's failure. It is the failure of the healthcare system to engage them meaningfully. Wow. This is a massive structural shift in medical thinking. It completely moves away from blaming you, the patient, and actually holds the healthcare team accountable for understanding your life. And to actually make that kind of meaningful engagement happen, doctors use something called the BPS model. That stands for biopsychosocial. It's basically a holistic approach that recognizes your biology, your psychology, and your social environment are all deeply, reciprocally interconnected, like a giant puzzle. Your care team is actively trained to look way past just your physical symptoms or a single number on a blood test so they can understand your entire world. Let's break down what this actually looks like in practice. Sure, biologically, they're looking at your blood sugar and genetics, but psychologically, they're trained to look for your fears. Like maybe you have a totally understandable fear about medication side effects that's stopping you from taking them. And socially, they're looking at cultural norms or peer pressure. For example, if you're skipping your meds because you feel embarrassed to take a shot in front of your coworkers in the break room, a doctor trained in the BPS model won't just sit there and tell you to try harder. They'll recognize that social barrier and actually help you strategize a discreet way to take it. It directly connects your physical health to your very real human experience.
Which brings us to Section 4, the OR's communication framework, how doctors listen.
So now that doctors know exactly what biological, psychological, and social factors they need to look for, how do they actually get you to open up and share them? Have you ever wondered how highly technical medical professionals actually learn the very human art of conversation? Well, they definitely don't just wing it. They use a highly structured technique.
Okay, let's dive into the ORS framework. OARS. This is literally the structured communication playbook doctors use to make sure you're an active participant in your care. O stands for open questions, so asking things like, how is your condition affecting you today, instead of just simple yes or no questions. A is for affirmations. That means praising your actual efforts and strengths, even if the outcome wasn't totally perfect. R is for reflections, repeating your thoughts back to you to show they're truly hearing your concerns. And S is for summaries, kind of putting the whole picture together to make sure everyone is on the same page before moving to a treatment plan.
And here's the thing, OARs isn't just a simple checklist you tick off and you're done. It's a continuous feedback loop. This cycle of questioning, affirming, reflecting, and summarizing is intentionally designed by healthcare educators to build deep trust and mutual respect over time. It guarantees that the doctor isn't just talking at you, but genuinely working with you. The reason this specific kind of communication is absolutely vital is summed up perfectly by Professor Timothy Skinner. He realized that forcing clinical agendas on patients simply never works. Because at the end of the day, diabetes is a self-managed condition. You are the one doing the hard work every single day. Therefore, your personal reality, your goals, and your priorities absolutely must dictate the care plan, not the doctor's assumptions.
And finally, Section 5, a lifelong partnership, putting it together. So let's bring it all home. You know you need to bring radical honesty to the clinic, and you now know the exact frameworks doctors use to listen to you. So how does this translate into a lifelong management strategy? Well, building a true partnership involves 3 key steps. First, you and your doctor will set SMART goals. Goals that are specific, measurable, action-oriented, realistic, and time-limited. But crucially, they have to be aligned with your personal values. Second, doctors are trained to use teach-back methods. So instead of just asking, hey, do you understand, they might ask you to explain the plan back to them in your own words. It's just a fantastic, totally non-judgmental way to confirm you're perfectly aligned before you walk out the door. And finally, remember, it's not just you and the doctor. You'll engage in interprofessional collaboration. That means tapping into the expertise of pharmacists, nurses, and dietitians, too.
The biggest takeaway here is that you really are not alone in this. Yes, diabetes is a super unique condition because the daily self-management is entirely in your hands. But your primary care doctor, your endocrinologist, your nurses, your pharmacists, they are all specifically trained to act as your coaches, your motivators, and your problem solvers. You literally have an entire team in your corner, just waiting for you to engage with them. Which brings us to a final really important thought. Dr. Hamdi notes that with proper management, people with diabetes can live incredibly full, vibrant, healthy lives. But the daily task is ultimately yours. Now that you know the secrets your doctor wishes you knew, and you understand the exact frameworks they use to listen and support you, the ball is totally in your court. Will you use these tools to build a powerful partnership, or will you let fear hold you back? Will you control diabetes, or will it control you? Thanks so much for joining me on this explainer, and I really hope this empowers you to step up and take collaborative control of your health journey.